their presentation. So without further delays, welcome and thank you, Annette and Nancy. Let me know when you would like me to share the slides.
Thanks for having us.
Pleasure to be here.
Okay, thank you. So I'm gonna go ahead and share. Okay,
Okay,
do you see the slide?
I see them.
Okay, all right.
So, as Marie was saying, I'm very interested in the benefits of physical activity for people diagnosed or living with a diagnosis of cancer. I'm a student, a graduate student at ASU, and my dissertation is about exercise and physical activity. But I'm also a survivor, and I think it's always important for us survivors to share our stories. When we share the stories, we also share our resilience and our experience of healing. And I, for one, and I'm sure most of you agree, that we support the values of survivorship culture, which includes both lighting the path for others who are following us and encouraging those who are walking the path right along with us. My story is that I was eating dinner on a Sunday night and I had difficulty swallowing. My food felt kind of blocked in my throat. And I went into the bathroom and looked in the mirror, and what I saw was this red mass about the size of a golf ball sitting in my throat. So the next day I went to the doctor and I was diagnosed with cancer. My cancer was really aggressive, and my treatment was aggressive. And as many of you know, aggressive treatment is exhausting, and there are sometimes some really difficult side effects. That was my case, but I did come through far better than anyone thought. And my oncologist wondered aloud if it might have been because I was very fit when my treatment started. Next slide, Maria. So this is more about me. I was athletic. I was diagnosed in 97 at the age of 42. I had head and neck cancer, a poor prognosis, and radical surgery and radiation. Next step, or next slide. So who are we? For better or for worse, most of us survivors are people in treatment and beyond who are not exercising. And there are plenty of very valid reasons. There's fatigue, schedules that are overwhelmed by treatment appointments, maintaining work and family roles, pain, uncertainty about safety, but far and I think by far the reason why people in treatment for cancer are not exercising is because exercise advocates like me have so far done a poor job of explaining how important it is to exercise during treatment and beyond. Next slide. So from 2014 to 2017, my role at Mayo Clinic was to help survivors reimagine their approach to survivorship and to help overcome the culture of rest that is associated with cancer treatment. And finally, to dispel the myth that during treatment, survivors should take it easy and not push themselves. You know, it's really easy to fall into this sort of non-exercising frame of mind because fewer than half of oncologists regularly mention exercise or physical activity, and fewer than a quarter refer their patients to an exercise program. Part of this is because oncologists have time-pressured appointments. They need to discuss your concerns, test, treatment success, and plan the next step forward. Few oncologists have time or expertise to talk about exercise. And survivors assume that symptoms like fatigue and depression are just normal parts of treatment. But that is not true at all. And repeatedly, I have seen treatment-related side effects and symptoms disappear when survivors start to exercise. Next slide. So if you go to Google Scholar today, like I did, and you enter 3 keywords, exercise, oncology, and benefits, you'll get about 33,000 hits. And what you are getting are reports, professional, published research. And we have a mountain of incontrovertible research evidence developed by exercise oncologists that indicates that exercise during treatment gives you these benefits. It also, in the larger scale of things, reduces your likelihood of of falling out of remission, and it also reduces the benefits of being diagnosed with an additional cancer. Next slide. So researching treatment outcomes is complicated because everyone's situation is different. But we have strong evidence that exercise during treatment can improve your treatment effectiveness in these 3 ways. Helps you get through your treatment schedule on time, you miss fewer scheduled treatments, it spreads the cancer drugs throughout your body more effectively, and it stimulates your immune system. Next slide. So the question is, when should I start? And the answer really depends on you. One of the best reasons to ask your oncologist for an exercise referral is to get the advantage of having an exercise oncologist evaluate you and look at when is the right time for you to start and what is the right time for you to start exercising. But I really encourage you to consider this, and that is to start today. Next slide. First of all, you don't need to exercise for nearly as long as you think you may have to exercise. For example, the guidelines for people in treatment is 90 minutes of activity a week. That's 3 sessions of 30 minutes. But I much prefer thinking about exercise as activity snack. And each snack lasts for 15 seconds. So let's start with an upper body movement that I call pushing air. And if you can see me in the smaller square over here, let me demonstrate it for you. It starts out with you sitting straight up, your back is straight, your arms are in front of you, you get this strange look because of the camera, and your palms are open. And you push to the front, and then come back and push above your head, and then come back and go to the side one way, and come back and go to the side another way. So we're going to do this for only 15 seconds. But I want to ask you afterwards how long that 15 seconds really feels like. So are you ready? Maria has the music. She'll start it for us. Remember, out, up, side to side. So Maria, back a couple of slides. Back some more, Maria. More. Back again. Back again. Back again. All right. Oop. Here we go. So it looks like we're having trouble with the music. Is that it? You should be able to just pick up the, there it is. 10, 11, 9, 10, 9, 9, 1. Okay, that was actually more like 13 seconds because we started it a little bit late. But were you surprised at how much you can do in 15 seconds? And that's the big idea here. So one more thing, let me say, I think I told you I had a lot of treatment, a lot of radiation. I let you do the math, but that's almost 27 years ago now. I still have one side effect, which is very little saliva. So I have to drink a lot. I apologize for that. Saliva is a really underrated body fluid, though, I will tell you. All right, next slide. Okay, so this is what we call the dose response curve, and it was developed very long ago. You can see in 1995, but the impact and the truth of this curve is only being proven more and more every time we do the research. And that is, if you are already doing a lot of activity and exercise, adding a little bit doesn't bring you that much benefit. But if you are like most of us survivors and you are doing nothing or almost next to nothing, then the benefits you get from doing just a little are huge. And when I talk about doing just a little, our goal, the goal I want you to think about is 5 minutes a day. That's it. And you can scatter it throughout the day as we're doing right now in these 15-minute exercise snacks. So, Maria, next slide. Okay, so what is exercise? Exercise is anything that increases your heart rate. So walking, if you walk briskly, will increase your heart rate. Lifting things increases your heart rate. Pushing things like wall push-ups, or even pushing yourself up out of your chair and then sitting back down and up and down. These things all qualify for exercise. Things that don't qualify for exercise are things like gardening or even doing some light housework if you're not doing enough to feel your breathing slightly increase or your heart rate comes up. So let's go to the next slide. This is our second 15-second activity snack. So wherever you are, if you're on a chair with wheels, stand up or stand close to a counter or hold on to your desk. Or if you're not feeling that great today, stay seated and just extend your legs in front of you. I'm going to stand up to a counter and I'm going to march in place. So if I do that, you can see my t-shirt, but trust me, I'm going to try and bring my knees way up. Okay, so Maria, can you start the music and get ready to begin? Right, well, Anderson. I just love those three little moves at the end. So now you have 30 seconds of exercise behind you. I'm hoping that you felt a little more energetic, a little heavier on the breath because now you've done 2 in a row. So next slide. So I want to talk to you a little bit about some free um, resources that are available to you. And one is that I want to show you this free website, movingthroughcancer.com, which is an online version of the book, Moving Through Cancer. And the book's author is Dr. Catherine Schmidt. Dr. Schmidt has been an exercise oncology researcher for more than 25 years. And she has a statement which I want to read to you because I think it's extremely powerful. And what she says is, we are at the point where we know exercise is an evidence-based treatment with robust effects. If we don't prescribe it, when does that become malpractice? It's really something I'd like you to think about. Because Dr. Schmitz couldn't find any in-depth, step-by-step exercise guidance for survivors like you who may be undergoing treatment but haven't received any guidance, she created a book. And this is that book. The book is about $20, but you have access to all the information for free on this website. So please take a minute and copy it down and take a camera, take a picture of it, movingthroughcancer.com. And her program involves these 5 steps. Next slide. Another exercise snack. So the first thing I want to point out to you is that those of you who live in Tucson are extremely lucky. You have one of the biggest and most active survivor exercise program groups in the country, and that is Tucson Cancer Conquerors. So if you haven't heard of them or you haven't looked into this, I strongly encourage you again to look in your own backyard for one of the best resources available. We're going to do an exercise snack now, and this one is called cross body disco. So I'm going to stand up, but what I'm going to do is push my hands up and to the side, then bring them to the center, and then down to the other side, and then back to the center, up to the other side, down, and back. And I confess I get kind of carried away by the music, so I don't always do it right each time, but you get the idea. Just keep moving up to the side, down, up to the side, and down. And Maria, you can stand or sit for this one. Here we go. That's it. Keep going. How was that? Another 15 seconds. I almost got all the way through it without losing my place. Next time. Next slide.
Until we don't get Nancy to sit still for very long.
So I want to just point you to this amazing podcast. It's really the history of survivorship. And survivorship is much more about the people who created the organizations and the integrative medicine opportunities that you have now, and not about the disease. So again, you can look on your podcast. It's called Cancer Maverick. Next slide. So this is one of the slides which I think is really key for all survivors. And that is that your medical condition, your past, what you are doing right now, what your schedule may look like in the future, is all unique to you. And there is no one-size-fits-all solution here. Timing matters, your treatment timing matters, your treatment matters, the order in which you get your treatment matters, and all of these are complicated issues. exercise leaders in the community and personal trainers do understand well how people respond to exercise if they do not have cancer-related impairments. But for most of us, in treatment or recently completed treatment, understanding how disease and treatment-related side effects affects the amount and the type of exercise that is right for you. And that information is what you get when you have an exercise referral, when you ask your oncologist for an integrative medicine or exercise referral. Next slide. All right, this is it. 1 minute here and 15 more seconds. This one, I'm gonna like leave the screen and come back to the screen. So we're gonna go side step twice, then back, side step twice, then back. I hope you already have the Village People and YMCA running in your head so that when Annette is talking, you can be thinking, oh, after this, I'm gonna do another 2 minutes. So if you're ready, here we go, 2 minutes. Side twice, side twice. Annette is great. That's it. Maria, you too, if you have room. Start the music. Here we go. Coming through. 1, 2. All right. So I have you all up and ready. I have you, I hope, breathing hard. I hope you have enjoyed it. And now it's time to get to the real meat of the presentation. And that is my colleague, Annette Monaccio. And take it over, Annette.
I can't even up that, Nancy. You always, you leave me with all the fun stuff after that. So I don't have the great music that Nancy has, but I want you to keep that in your head while I continue talking. And hopefully, if you're sitting in your chair, you can be doing a little marching in this at the same time, getting those little snacks in as I'm talking. So to try to keep you awake during mine. So anyways, again, Maria, thanks for having us. Nancy, it's always a joy to present with you. And so I am Annette Monaccio. I'm an occupational therapist by background. I'm also a certified hand therapist and a certified oncology specialist. And I love talking about exercise and anything related to therapy. And so hopefully we can talk a little bit more about your cancer journey and things that hopefully will be new to you that you can also share with others. So with that said, we're going to talk about cancer rehabilitation and living well beyond cancer. So next slide. So I love this slide because it talks about a road trip, and truly everyone's cancer journey is a road trip, and everyone's path is very different as they go through that journey. So people start from different places, different ages, different sexes, belief systems, support systems, family and friends, faith, and other different medical conditions that you experience. Cancers are not the same, and treatments, as you all know, vary very greatly. So tolerance also to the treatment varies, and again, is based on lots of different factors, pre-existing conditions, and a lot of factors that we still don't understand. So today we're going to explore some of the benefits of cancer rehab and how it can support you through that very road trip and journey that you're experiencing. But first, next slide. What the heck is cancer rehab? So cancer rehab is a process that helps others with cancer maintain and restore their physical, social, and psychological or vocational functioning, set with the parameters or within the limitations of the disease and treatments that you're experiencing. So for therapy, it may include different things such as physical therapy, which often people have experienced some point of their life outside of cancer or know someone that has. occupational therapy, a little more of a mystery, and also speech therapy. We have exercise fitness guidance, as Nancy was discussing, and also a few other specialty services, one of which is pelvic floor therapy, and then lymphedema therapy services. So next slide. So I don't have music. Nancy might have to hum for us. But what I'm going to do is just have you start with doing just more of a shoulder stretch today with me. I can't see everyone, but I'm going to assume I see big smiles and really excited because Nancy's got your, your heart racing a little bit. But what we're going to start with is just rolling your shoulder in circles. So just taking your shoulders nice and big and just rolling forward toward the front and back. Nice big stretches. 5 times, no holding your breath. Good job. And then we're going to go the opposite direction. So we're going to go back and around for 5 and 4 and 3, 2, 1. And again, nice deep breath, relax. We're going to shrug our shoulders like, I don't know, up and down all the way. And again, we'll do 5 of those. And up and down. 2 more. Good. Make sure you're breathing. Good job. Good. And then what I want you to do is gently slouch forward, like you're just kind of like leaning over, just taking all your body weight in. I want you to take a breath while you're down in this position. Just feel that. Okay. Then what I would like you to do next is straighten up tall, shoulders back, head up. Now take a breath. And I want you to see what felt a little different. So when you're slouched forward and you try to take that breath and everything's being squished in front of you, and then you come up straight and everything, good posture, and you breathe, you expand your chest wall, you expand your lungs, so much better. Again, helps that breathing better, helps everything kind of flow better. So again, you can't see your hands. So I was going to say, show me hands of who felt that it felt differently. But if you have a thumbs up or you want to do any of that on the screen, or if you're fancy with your chat, you can put a couple comments if you'd like on there. But keeping that in mind for just everyday life when we're looking, instead of looking for the ants on the ground, let's look for the sunshine in the sky and keep it nice and bright and tall, rather than looking for the ants, because they're going to be there, they'll be crawling around, but the sunshine is so much more fun for us. So welcome again to your first introduction to cancer rehab. And thank you. And I'm going to give you a round of applause for participation. All right, next slide. So on this one, Maria, it's a little funny because you have to kind of do it again, so it'll bring things down. So we're going to talk about physical therapy and oncology and what common conditions that are addressed by the PTs. So PTs can address many of the impairments that result from medical treatments from cancer. And here are some of the top conditions that we're going to focus on today. So decreased strength is an area they're working on. Range of motion, or the ability to move your joints, arms, legs, overhead and below. Looking at impaired balance and falls. Looking at deconditioning or fatigue and musculoskeletal pain. Now, what I hear about a lot of times on these particular calls, like we are doing today, deconditioning is huge, right? It's the fatigue, the difficulty, just wanting to get up, get dressed and do your thing, and even just getting to that doctor's appointment. So that's one of the areas that your physical therapist can certainly work with you to, again, address those small snacks that Nancy talked about, and then bringing you up through a really great strengthening program with time and when it's appropriate. So next slide. And then you'll do again that double click. There we go. Thank you. So the other area, again, my special love, because I'm an occupational therapist by background, the OTs work closely with the physical therapists, and our approach may look a little different and our goals might focus a little different. The focus of the OTs tend to be to manage conditions that impact someone's cognitive function. And how many times do you hear or know about quote unquote brain fog, where you feel like you're in the clouds, you're not feeling quite, yourself, and you're having difficulty performing maybe some activities of daily living or different things that you do during the day. So there's a few things that the OTs or occupational therapists can work with. And they're going to include things like looking at bathing and dressing and cooking and just returning to regular work shift needs, things at work that if you're wanting to get back into the work-life balance and trying to figure out, how can I get in and do a partial shift or a full shift, the therapist can work with you on how to navigate through some of that. Things like shopping or even lifting. How the heck am I going to lift those groceries out of a car and get them into the house? How am I going to do anything where I'm doing any walking around even in the grocery store? So these again are things and strategies that the therapist will work with. Things that OTs work with, again, that are a little different are looking at fine motor skills, things like writing, looking at buttoning and zippering and typing and opening jars and how to get that key into the keyhole of your car and shift a car. So the therapists are going to be looking at things like, we'll talk a little bit more about this, any adaptive equipment that might be helpful or useful, things like building up little handles if you're needed. But sometimes people have that neuropathy sensation or loss of sensation in their hands or feet. So how can we improve and make things easier for any kind of writing? So things like built up handles on the pens, or maybe just using a felt pen rather than something where you're having to put a lot of pressure, making it a little bit easier to do. So OTs will look at all those. We are, I have to say, very crafty and can come up with lots of different items to make things a little bit easier in life. The other thing they're going to look at are really talking about saving energy. Energy is huge. And when we expend our energy just to get up and to get dressed or take a shower in the morning, sometimes you're like, forget it. I don't even want to try to take a shower, particularly during or right after treatment. So again, there's different strategies that the therapist can work with. They talk about things like using devices such as a seat in the shower, or just even holding on to a hose rather than trying to get around the water in the shower. And then also giving yourself a little bit of kindness to know that it's okay to take breaks and to do things in low doses rather than all at once, and I think sometimes we make things difficult for ourselves and try to overdo it when by the time you're done getting dressed, then everything you plan for the rest of the day is shot. So I think, again, the OTs can really help out with those type of things. OTs will address cognitive impairments, so issues with memory. And again, back to that brain fog, looking at ways to strategize the memory and short-term memory issues that people may have. Might be writing things down in a journal book, keeping a calendar, crossing things out as you go, giving yourself lists, but finding out different things that work best for you. And everyone is a little different. And what might work for me on my cell phone and putting notes into this thing might not be the same for someone else and is a paper and pencil person that would rather do this on a calendar in the kitchen. So they can work on things like that, working on focus and concentration on doing different tasks rather than losing focus and trying to cook on a stove and forgetting that the oven's on and what's going on, let's go on to the next thing. So really focusing in on safety within the home as well. So again, they're going to assist to find strategies and solutions to improve day-to-day functions in all these different areas. Okay, next slide. You can tell I have a little passion for OTs. Just don't tell anyone. Okay, so here we're talking really into the speech and language pathology specialist, so speech therapy, as you hear oftentimes. And these therapists are able to help manage impairments that may also result from medical treatments from cancer, such as cognitive impairments, looking at things like speaking difficulties, something called dysarthria, in which it's difficult to form the motor components of producing our speech. They look at swallowing issues, and that's called dysphagia, sometimes with certain types of cancer, particularly with any kind of radiation and fibrosis, or again, different types of medications that are needed. There are some difficulties with swallowing. So they teach new strategies to help with swallowing. They also work with some of your other medical team members to work on different types of things, such as modified barium swallows or other things to look at to modify your diet from maybe instead of a really hard diet to maybe a softer diet to make things easier for swallowing. The speech therapist may perform these special tests for swallowing and eating to just really find safe strategies. Again, we don't want to have anybody try to swallow and aspirate. So these are, really areas that we take very seriously within your therapy strategies with this team. And so they work really closely with your physician on changing any of those dietary needs from either liquids or soft foods or, whatever that might be. They address the loss of ability to move your jaw or facial movements. And again, something called trismus, where again, from due to some of the treatments that you have, might be some radiation, it makes it difficult to open and close your mouth or your jaw. So opening and closing, things get really tight, and all of a sudden you're having difficulty opening enough even to take a bite of food and swallow. So the speech therapists really work on some soft tissue work on the jaw area, and then also work to show exercises and things to make it a little bit easier to use those facial muscles. Next slide. There are different areas within the physical therapy and occupational therapy areas of practice that some therapists even specialize even further. And two of those areas are lymphedema therapy and pelvic health therapy. So lymphedema therapists are typically certified and they're trained to address swelling and edema. So it might be a head and neck issue where there's some swelling through here. It may be through the breast area. If anyone has lung cancer, also looking at the center portion of the body where we get some swelling, or even some arm or leg swelling. So they use specialized manual techniques, or they call it lymph drainage techniques, to reduce swelling. They use different types of wraps or compression, and sometimes we'll use things like pumps for home use. They address your skincare and activities and exercises to continue to perform some of that at home. For pelvic health therapy, I like to talk about this because this is one of those therapies that goes often in the closet. People don't like to talk about issues related to their pelvic health issues. And I encourage anyone that hears this today, or, if you know somebody that's having some issues, that there are therapists that really are experts in this field and are very passionate about what they do. And they can assist individuals with any internal and external treatments to improve things like bowel and bladder incontinence issues, sexual dysfunction issues, and they have you continue with home programs to continue to strengthen or relax muscles to improve these areas. So with incontinence, a lot of times there might be issues where we have a lot of tightness in our muscles, so much so we're afraid to try to release and alleviate bowels or the bladder. So the therapist will teach you to relax those muscles to allow yourself to properly, expel the bowel or the bladder. On the flip side, it might be that those muscles are just really not working so well and they're really low tone, so they can't move. They're not squeezing hard enough, so you're incontinent because those muscles are they're not strong enough. So those therapists work very closely with you to develop and design programs to help that area. They talk about nutrition, they'll talk about other things related, use of caffeine, et cetera, and what irritants might cause some additional issues for that. Sexual dysfunction comes right out of the closet and they talk all about it, and there's no boundaries, and they oftentimes will ask the partner to come in if it's appropriate. And talk about issues related to sexual dysfunction. So a lot of times, again, if there's any kind of rectal cancers or, ovarian cancers or anything related to the pelvis, that we do have tightness that becomes an issue for individuals. So again, they talk about using different items and different types of biofeedback units that they do internally and externally, which can show you how to, again, best relax muscles if they need to be relaxed, or tighten muscles as they need to be tightened, and really talk through partners. I think sometimes it's difficult for partners that aren't experiencing the dysfunction to understand what that looks like. And I can say, and I'm not a pelvic health therapist, when I see individuals come in with partners to their therapy sessions and really talk through it with the pelvic floor therapist, it is amazing, and it's almost transforming when they leave that session with smiles and understanding, and really it changes everyone's world. So highly encourage that piece as well. Next slide. So the big why. So why cancer rehab? So evidence does suggest that 60 to 90% of people affected by cancer can benefit. They can benefit from some sort of trained therapist coming in to help them. However, it's very interesting that, and I know we can't show us a show of hands here today, but when we've done this in the past and asked, Nancy and I would ask, well, how many people here have attended any type of therapy related to issues that they're experiencing, and they've been through cancer rehab? Less than 10% of people actually get services that are required or should be available to them. So hence the reason why Nancy and I are here talking from the top of the mountains to talk about cancer rehab, to say it's great to be your own advocate. It's great to educate your providers, because oftentimes they don't know. You know, we try to go out and provide that information to as many oncologists or providers as we can. Obviously, we're just two people, you know, but there's many others out there trying to spread this news. The good news is I feel like people are starting to see that it's a standard of care much more than we used to see, but it's not always the case. So if we remove individuals outside of lymphedema that are getting any type of cancer rehab, so those individuals that have swelling and issues related to that, if we took them out of that mix, now we're down to 2% of the population that are actually getting any type of therapy services. So that's a big wow for us. Nancy and I, it's almost like we didn't want to believe it. So again, I encourage you highly, if you're finding, you say, oh yes, I see myself in one of these areas, just know it might be something to really consider for service for you. So, so why is it, again, that only 10% of these individuals receive care? We know that not a lot of providers have specialized training and understanding and what those services are and what we can offer. So by educating the general population and those affected by cancer, I think you're the best advocate for yourself, and you know what your needs are, and to ask, is it appropriate for me? So next slide. And this is another one that has multiples. Yeah, there we go. There's a couple more on there, I think, too, there, Maria. So what are physical impairments? A physical impairment is considered a disability that limits a person's physical capacity to move, to coordinate different actions, or perform activities. So physical impairments lead to functional limitations and decline. So things such that we talked about earlier, things like neuropathies or tingling or numbness, that may affect something like being able to walk on a slippery sidewalk, or shoulder stiffness, making it difficult to reach overhead to lift a small child, or in my case, a grandbaby, or to reach into a kitchen cabinet to get those chocolate chip cookies that no one knows are hidden, or generalized conditioning or instability that makes it difficult for someone to do something like walking their dog, or climbing downstairs, or just running to get the mail, or walking to the mailbox. Next slide. So even healthy individuals acquire different types of physical impairments over time. Sometimes we don't even know it. So the progression sometimes is very slow. Again, we have bad posture, sitting at a computer, and over time, and it can happen overnight. You know, it just happens. The next thing you know, things like you're tripping or you feel like you're falling, again, starting to notice some changes. So physical impairments, especially combined with functional limitations or the inability to do any type of normal daily activity, can change things in life. It may affect the ability to live independently or return to normal work capacity if you're returning to work. And as we know, there's three main ways of treating or managing cancer. One is surgery, chemo, or radiation. And we also know that they all have anticipated side effects that can manifest and physically have functional limitations or implications. Sorry, I shouldn't even have that word on my list. Okay, next slide. So in summary, as discussed, here are some of the most common cancer and treatment related effects that we hear about. And our first goal is to provide you with information about cancer rehab services and how you might benefit from them. Second goal is to help you take the next step. So again, the things that we're looking at that as a therapist, they can help. We're looking at things like pain, cancer-related fatigue, weakness, deconditioning. If you're feeling any bells going off, these are things to consider. Peripheral neuropathies, which is that numbness and tingling that we talked about. Gait or walking or balance dysfunction, any kind of cognitive impairment, the brain fog. Soft tissue changes, we talk about scarring, we talk about radiation fibrosis. We talk about activities of daily living, self-care issues that you may have, any kind of dysphagia or swallowing issues, dysarthria with talking, the swelling or the lymphedema issues, pelvic floor issues, incontinence issues. Those are all things, again, that clinicians can help you with. We're going to open for any questions that you may have and hope that some of this information is helpful as you continue your cancer journey. We've added some different resources and a quiz here for you just to look at and to see, have you fallen or had any near falls in the last 6 months? Do you have a fear of falling? Do you have any weakness, numbness, or tingling in your legs, feet, and I'm going to add hands? Are you taking any more than 4 medications? Do you have any impaired vision, dizziness, vertigo, or feeling off balance? Do you have to go to the restroom more than one time in the evening at night? Or have you noticed any kind of changes in your thinking, memory, or multitasking? If you've answered yes, that might be something to consider, or even having a further discussion with your physician to see if, again, cancer rehab, or as Nancy talked about, exercise and starting with some gentle snacks of exercise could be beneficial to you. I don't know if there's another one, Maria, on the next slide. Might be a couple more here. We do have through Revital, which is our cancer survivorship through banner. Previous slide right there, Maria, it's a survivor series as well and related to cancer rehab. So again, this will just, if there's a QR code, and Maria, you're welcome to share our slides and they can certainly look at the QR code. And what it is that will give them more information from others that have attended cancer rehab and kind of what their experiences are. So I think that's always helpful to hear from someone other than us. And then the last one I think is Nancy. Are those the next one? These are some of the webinars. If you go on to the Revital website, you'll see revitalcancerrehab.com. It'll give you lots of great information and different webinars that you can see that are pre-recorded, and then the live ones are usually once every quarter as well. So that is my information and Nancy's information. You are welcome to reach out. Those are our mobile numbers that are right here next to us. So you're welcome to call us anytime. We'd love to hear from you. And certainly if you prefer an email, you can always email us as well. Nancy, do you have anything to add? I think there might be another resource for you, isn't there?
I think this is fine. Maria has a list of resources that she will be sending out to people, and
Yes, I do. I have. So I will email the list of resources to the attendees. And that was a fantastic presentation. So thank you, Annette and Nancy. Let me see if there are any questions or in the chat. Let me see. I don't see any questions here.
So I'm very curious about the idea of 15 seconds. How did that go over with you three attendees? Did you like that? Was that helpful? Fun?
Any input? Feel free to use the Q&A or the
Just
chat
me?
box. Okay. I don't think we have any questions,
I do have a
but
quick, have a quick question for them, and they can, if they know how to use the chat, or I don't know if they can open mic. I don't know if you have open mic option here. I'm just curious if anyone has experienced any type of therapy in the past for their treatment, if they are willing to share. I don't need to know their story. Just curious to know if anyone has attended therapy in the past.
has anyone attended therapy? I'm gonna type in a message and see if they see it, they'll find the chat box.
Yeah.
I see a message from Maddie, basically saying hello, hello.
Yep. Hi, hello, Maddie.
Great.
All right. Well, I want to thank you again, Annette, Nancy, for your time, for sharing your expertise with us. This has been fantastic, and I will send those resources to our attendees. And I also would like to remind everyone that we launched an online complimentary yoga class today. It will be every week on Wednesdays from 9:30 to 10:30. So if you're interested, you'll be able to participate in the session from home. They're complimentary, and if you would like to register, feel free to give me a call, and my phone number is 520-621-9496. So thank you again to all who are here today, and thank you, Annette and Nancy.
Thanks again.
It was fun. Thank you all for coming.
Bye-bye.
Bye now.